is a case presentation from my medical externship at Baptist Health Outpatient Rehabilitation Center in Corbin, Kentucky. This client is a female. She is 3 to 5 years old. She lives at home with her parents, grandparents, and older siblings. She does not attend school yet. When she first came to the outpatient clinic, her mother's main concerns were that she had difficulty with basic concepts and foundational skills. She was difficult to understand. She had food aversions. She had difficulty with mastication. And she also had voice differences in pitch, volume, and resonance. Her medical history includes a diagnosis of Freeman-Sheldon syndrome. Individuals with this type of syndrome present with a prominent forehead, inset eyes, and a very small mouth opening. In her lifetime, she's had 6 to 7 cases of aspiration pneumonia. She has a history of otitis media and PE tubes. She just had a recent surgery to remove all of her teeth. She has scoliosis. She is not on any medications at this time. She has vision difficulties, asthma, and as an infant, she was diagnosed with failure to thrive. Her physical limitations include a paralyzed upper lip, her mother report, and she is hypotonic. The family, especially her mother, is very supportive and involved in the care for this patient. She is able to receive speech therapy, physical therapy, and occupational therapy here in Corbin. However, the patient and her family have to travel to outside areas frequently to see specialists due to the severity of her diagnosis. Around 3 months ago, an evaluation was completed on this client. Her results indicated that she had many speech sound production errors. She has receptive and expressive language delays. She has an abnormal pitch, loudness, and resonance in her voice. She is hypotonic. Her top lip is paralyzed, and she has a high palatal arch per parent report. She has many food aversions, and she also pockets food in her oral cavity. The physical therapist and occupational therapist also performed evaluations on this client. The physical therapist determined that this client was hypotonic and had delayed gross motor skills. The occupational therapist also found out that she has delayed fine motor skills. The diagnosis and focal problem of this case is that she has a mild receptive language delay, a moderate to severe expressive language delay, and a moderate to severe oral dysphagia. The goals for treatment include the patient will communicate messages that are comprehensible to familiar and unfamiliar listeners utilizing verbal speech skills for functional communication. Also, the patient will improve expressive and receptive language skills to allow for maximal functional communication in ADLs. Some of the short-term objectives for this patient is that she will verbally request change of task. She will demonstrate age-appropriate attention tasks, demonstrate turn-taking during play, verbally answer yes-no questions, verbally respond to WH questions, and the patient will be 90% intelligible in known context and 80% in unknown context. The therapist is to monitor articulation and address, when and if appropriate, due to anatomical abnormalities in the paralyzed upper lip per mother report. During treatment, we use an enhanced milieu teaching approach. The patient is always compliant to participate in therapy. Changes and adjustments during the course of treatment will be made if patient meets goals or new goals need to be added. Overall, Overall, the patient has made great progress in therapy. Her expressive language has increased greatly. She is now trying new foods, such as potato sticks, and drinking from a juice box using the straw. Her receptive language is improving. There are no plans for discharge at this time. Patient needs to continue therapy services. All in all, I have learned a lot about Freeman-Sheldon syndrome. I have learned different ways to treat individuals with this syndrome, which I feel can be applied to other cases with other children who may have different syndromes or the same syndrome. Next time, I will research more about this